Hello. So I'll start with a disclaimer. Basically, enjoy these videos, but don't do anything with them on your friends and family. So here we have a gentleman who's got a very chunky corn, causing him quite a lot of pain. He's also got other bits of hard skin off. So corns are essentially caused by pressure over a particular area. So a high concentration of pressure over an area will cause like a conical formation of a hard skin. So it's like hard skin but harder in the centre. So when I've chopped this big chunky bit, and they really do feel like you've got a big stone in your shoe. So now I've taken that bit of hard skin off, you can actually see that there is kind of a shape, like a spot within the middle. Now that's the actual, what we call the nucleus of the corn. So that's the central part of the corn. And like I say, they really feel like they're a stone in your shoe. When you cut them out, they're as hard as glass. So it feels like that when you're walking on them. Now, like I say, they're caused by pressure over an area. So for this gentleman, it's over like the ball joint of one of his toes, if you like, underneath. And that can be down to biomechanical causes, so the way that his foot works, which is causing like retraction of the toes, etc. But yeah, ultimately it causes high amounts of pressure over a particular area, and the body responds then by creating hard skin, and then if the pressure continues, corn formation can occur. So what I'm doing here is actually removing that nucleus part, that central part of the corn, which will, once that's removed, it will create a whole, well, it was just so much more pain-free. While I'm doing it, does it hurt? Not the most comfortable thing sometimes, especially when you're getting right down near the base. This is a particularly chunky one, so the tugging of the blade can cause a bit of discomfort, but is it more than anyone can bear? No, it's not. It's still better than living with it. So every step he takes at the moment, he can feel like it's digging right in, and it's extremely painful. So he's been very much looking forward to coming to get it done, and he knows he'll be much, much better off after it's all been cut out. Essentially, sometimes you can nick a patient. Obviously, we're using very, very sharp instruments. We use a sterile blade for a separate blade for every patient. They get discarded after use, and they are incredibly sharp, but they can blunt. If you're doing a lot of hard skin or what have you, they can blunt. Now, blades come in all different shapes and sizes depending on what you want them for. This particular blade is a 15 blade. These are my favourites, my personal favourite, but I think every podiatrist has their own favourite. This is mine. Some people find them too small, but I just love them. So yeah, they're, for me, certainly with enucleating corns, they're really, really helpful. You can just get in there, but yeah, they come in different shapes and sizes for depending what job you use. But like I say, they're all single use, and so they get thrown away in the sharps waste at the end of each treatment. So you can say bit by bit, I'm chopping away like the harder skin around the outer of the corn, working on that nucleus. This gentleman's been coming on and off for many years, but it's been quite a while since his last treatment. So ideally for all concerned, especially him because he's the one living with it, he would be able to come more frequently. But his personal situation means that that's not always possible. So we just go with what we've got on the day. So sometimes it can take a bit longer, it's a bit more uncomfortable than other times. Sometimes, or more often than not, with corns, there will be quite a nice circular central core nucleus. This one is kind of a bit more of a funky shape, That's nothing to be concerned about, but it's probably more representative of that. It's been around for ages, so there's a lot of scar tissue going on around there. Corns are very difficult to get rid of because, say, they come through pressure. So unless this gentleman starts walking on his hands, there is always going to be pressure over that area. So we can manage pressure using insoles or orthotics. Like I said, originally, these are often down to the way that the foot is working biomechanically. So we can use insoles to offload the area so that that particular area isn't taking all the pressure. We can like spread it out a little bit more evenly over the foot. And we can also address the main issues that are actually causing that joint to kind of drop down, or the retractions of the toes. So we can use that. There are also like more temporary measures, which this gentleman opts for, where is a bit of padding that can just offload that area, because sometimes it can be a little sensitive for a day or two when you've taken a lot off. Now, corns can also be more like sort of long-standing corns. Can be more common in smokers. So we all know that smoking can affect you in many different ways, and there is a lot of correlation between long-standing, what we call fibrous corns, and smoking, and they've kind of been dubbed smokers' corns within podiatry. What we do know is, say, they tend to return very quickly. So patients are coming back to us sort of 4 to 6 weeks. They tend to be extremely painful and quite substantial. But should the patient decide to give up smoking, we find they actually go. So although we know they are pressure related, there is definitely a relationship between smoking. So it's likely to be the vascular supply to the area. So your blood supply to the area, because obviously when you're smoking, you're inhaling a lot of other toxins, which then is causing disruption to vascular supply. But it is interesting to note that often we come across these, they are in smokers. So I'm kind of getting down to the bottom. I know this is quite a long one. I can do them quicker than this, but in order to video it for you all, it means the camera's slightly in my field of vision and in my way a little bit, so it does take me a little bit longer. Now I know when I'm getting to the bottom, when the tissue beneath starts to feel a little bit more spongy. The actual corn material itself, like I say, it's very hard, it's very glass-like, and so you feel that resistance against your blade. And when I get near where I'm not feeling quite so much resistance, I know I'm getting to the bottom. And for some patients it can get a lot more painful around, when you're poking around that bit there. Now, some corns develop, like I say, there's a lot of scar tissue with them when they've been around for a long time, but you can also get involvement with tiny little blood vessels, so capillaries, and or little nerves that kind of get disrupted and pushed up to them. They're classically known as neurovascular corns, and can be very painful when you're taking off that hard skin, because things have been pushed up into areas that, as in like your capillaries and your nerves have been pushed into areas where they wouldn't normally be, and so it's very easy for us to kind of clip them when we're using the blade. So often patients with neurovascular corns, they will only be able to tolerate a certain level of enucleation, so a certain level of treatment, because they're so painful. Again, there are different things we can try and reduce that pain and discomfort, more so long-standing, not so much during the actual treatment, and again they're quite common within smokers, but ultimately they're treated much the same as we would any standard corn. We're starting to get there now, and very finicky. I do like my patients to go as long as they can between appointments, being comfortable. So we've moved on now. So this is a chunk of hard skin or callus. It comes away, it's a bit like peeling a potato. So on the whole, when you're removing hard skin like this, it isn't particularly painful at all. It's like having your hair cut. Obviously you can feel me touching the foot and stuff, but it doesn't tend to be painful at all. Now, there are many of my colleagues who will be crying out, why am I still using that 15 blade? It's just because I love them, if I'm honest. I'm very, very happy with my 15s. But yet there are many of my colleagues who would now be changing to a different shaped blade or a larger blade to make much shorter work of it. But I just love my 15s. So I'm not going to diss those people who change their blades at all. But it is my my preference, and I know it will probably drive some of my colleagues bonkers watching me fiddle away with that tiny little blade. So again, a bit of hard skin on the side of the big toe joint there. These are very common areas for developing hard skin. Like I say, this gentleman hasn't been to me for quite a while, so it's been a very big gap in between treatments. So you'll see me every now and then, I kind of move my left thumb over the area that I've been cutting. Again, it's kind of personal practitioner preference, if I say that fast. But ultimately, it allows me to feel, I can feel the skin, as in I can feel how it's moving. Is it still really hard? Are there any ridges there that I need to take off? Is the skin kind of feeling more like skin should feel like? Now I've changed blades, yay! So this particular blade is a very sharp, pointy one, and is a number 11 blade. So I find these really helpful for doing heels, heel callus, and you'll see there's kind of a few like little lines within that callus. That's what we call fissuring. So it's like little cracks that you can get in your heels. Now, very common with people who wear like mules or open backed shoes, flip-flops, sandals, things like that. So yeah, and anyone who wears those will find that they do get build-ups of hard skin, and they are more prone to cracking, so fissuring. Fissures are reasonably easy to maintain, but it is a maintenance thing. So as long as you keep on top of that hard skin, so you can sand it at home yourself, come to me or colleagues of mine periodically to have the majority of the hard skin taken away, any edges of the fissures kind of leveling out, because the fissures these aren't very deep fissures at all. They can crack right down and open up, so they bleed and very painful, likened to sort of like having lots of little paper cuts on your heel. So like I say, more common in people who wear open-backed shoes or sandals, slippers, flip-flops, things like that. And yeah, easy enough to maintain. Give them a good sand and then moisturise, moisturise, moisturise. So on the heels, if you are prone to fissuring, then we recommend a heel balm or a heel cream, which has got around 25% urea in it. Urea is a component to any good moisturiser or emollient, because it not only holds moisture in the skin, it also pulls it in from outside. So you're getting a double whammy there, which is really good. The foot cream, after every treatment, our patients receive foot cream, and that's a standard foot cream which has about a 10% urea content to it. So that's brilliant for all over the feet. But if you do suffer with heel fissuring or very dry heels, then something a bit beefier, like a heel balm or a heel cream, which I'd say that higher 25% urea content in it, can be really helpful. There are loads of different brands that do it. We stock CCS, but Flexitol is pretty decent, and there are also lots of other heel balms and creams, but often it's a case of trying and see what works for you. So we've moved on to the other foot here now. There's not quite as much on this foot, but obviously it's important to get it all off. Sorry about the blur in there. The purple thing that you can see just beneath the leg there, it's called a body block, and what it does is, although we have an electronic couch that we could, the patient kind of goes up and down on basically, ours also tilts the patient back, so that's particularly helpful when you are doing heels. But ultimately, trying to get to that heel area can be a bit of a fiddle. So these body blocks are absolutely brilliant. So you just pop them under the lower part of the leg so that the heel kind of sits freely, and we can get right under there then. They're all autoclavable, which means you can sterilise them as well. So everything's nice and hygienic. Now I'm moving on to the toenails, because I think you've seen quite enough of heel chopping. So this gentleman has got, excuse the dodgy camera angle, this gentleman has got fungal infections in all of the nails of the right foot. Now this left foot is perfectly normal, which is, I've not bothered to show that because it was just a very slight trim. But the nails on the right foot do have fungal infection, which is why they look slightly more thickened and a bit more discoloured. And you have like levels of debris beneath them. Fungal infections in nails and on the feet, really, really common, not generally any relation to your personal hygiene. Athlete's foot is a fungal infection, and quite often of the skin, and quite often if you've had long-standing skin fungal infections, it can then affect the nails, and once it's underneath the nails, it's a really different bag to treat. Far more difficult, because the nails actually act like a bit of a coat of armour, if you like, in protecting them from any antifungal agents you might try on them. So there are various different bits and pieces we can do, which I'm sure we'll cover in a different video. But there is no short-term fix at all. It can be quite a slog to get rid of fungal nail infections, and you don't really need to get rid of them. You can live with them perfectly happy. Now this gentleman had complained he'd had a bit of a sore spot there a few weeks before. He doesn't know what happened or how it came about, but he'd popped a bit of antiseptic on it, and it kind of just popped and it had been okay. So it could well have just been a blister, which has been caused by rubbing of those two toes together because of footwear, or it could have been a little infection through like a bit of hard skin, or again just an infected blister. So the tissue is very white there. It's what we call macerated tissue. So anything that's macerated is very soggy, and then it does give this white, rubbery kind of appearance. So what I'm doing here is taking the roof of that blister, so the top part that's lifted away from the main body of the web space there in between the toes. Now just here I found kind of like a second roof. Now it looks like it's bleeding, it's not. That's just the tissue, the dermal tissue underneath. So the epidermal tissue is kind of sheared away now, and see, as you can see, that comes away very easily. So it's already detached, and that's why it's not bleeding, because I'm not actually causing any real mechanical injury to the tissue, other than just removing that top soggy layer off, which isn't really going to do anything but impede healing. So I want to provide a nice clean and optimal environment for that space to heal. So I'm now going to give it a little clean with some saline, some sterile saline, just to make sure there's like no bugs. There's no sign of any infection there, but obviously I want to make sure that that stays the case. You see it's all nice and cleaned up now. And I'm actually applying some iodine spray. So it's a dry powder spray. So it goes on as a bit of a wet squirt, if you like, and then it dries off to a powder. And I'm just popping a little bit of a gauzy dressing in between there. It's just what we call a dry dressing in between. And I'm actually going to kind of hold the toes together using a tube gauze bandage. And that just means that, you know, you're holding it into both sides. Now the gentleman will leave that on now for sort of 3 to 5 days, keeping it nice and dry. And then hopefully that'll have all dried off nicely inside, and he'll be on his way. And he does know he can contact me if he does have any problems. Now I mentioned that he liked to have a bit of offloading underneath. Oh, and that's all our bits that we chopped off.